Welcome to our video about Pneumocystis pneumonia. Pneumocystis pneumonia. What is Pneumocystis pneumonia? Learn about the symptoms and causes of pneumocystis. Then, learn how it spreads. We'll explain what this infectious disease is and what to do if you suspect you have it. Once you know what you're up against, you can start treatment. Read on to learn more about this deadly disease. What is Pneumocystis pneumonia? There are two types of fungus: true pathogenic fungi and opportunistic fungi. Both have similar symptoms but are different from one another. If the infection is not treated in a timely manner, it can cause severe problems. Pneumocystis is a fungus that thrives in the lungs. As with all fungi, there is no specific cure. In people with weakened immune systems, pneumocystis is a common cause of pneumonia. It is also the leading cause of death in people with HIV. Since anti-AIDS medication has made HIV infections less common, this disease is not as common anymore. The symptoms typically appear over several days to weeks. Once diagnosed, a doctor can prescribe antibiotics if the underlying condition is not treatable by antifungal medications. Treatment of this infection is crucial to preventing serious complications and saving a child's life. Medications for pneumocystis pneumonia are given orally or intravenously and can control the fever and pain. If treatment is delayed, the infection may result in death. Steroid medicine may be prescribed to prevent the infection in the first place. If the infection is not treated quickly, it can lead to death in healthy people. Pneumocystis pneumonia symptoms. Patients with pneumocystis pneumonia have several symptoms in common with other forms of pneumonia. The bacterium infects the lungs by attaching to alveolar type I lining cells and transitioning from trophic to cystic forms. The organism's presence causes a diffuse inflammatory response within the lung, leading to hypoxia and respiratory failure. This is a potentially fatal bacterial infection. People with a normal immune system seldom develop the symptoms of pneumocystis pneumonia. It is estimated that up to 1/5 of the adult population carries the organism. However, healthy individuals are able to clear it from their bodies without developing any symptoms. Patients with pneumocystis pneumonia may experience chest pain and cough for several weeks, followed by fever and fatigue. If your symptoms are consistent with those of a fungal infection, you should visit your doctor right away. In the US, the condition is less common than it used to be. If you are worried about the possibility of getting PCP, you should make an appointment with a doctor and undergo a full physical examination. A thorough medical exam will determine the cause of your symptoms. Your doctor will recommend treatment based on your symptoms. About pneumocystis pneumonia. The disease has complex epidemiology, but it is most common in people with impaired immune systems, such as those with AIDS. According to the corresponding author of a new study published in the MBioArt journal, pneumocystis pneumonia has become an opportunistic agent that strikes people with decreased immune systems. It was not previously known what caused the infection, but it gained prominence during the 1980s. Infections caused by fungi are known as pneumocystis pneumonia or PCP. This fungus infects the lungs and is particularly dangerous for people with compromised immune systems. Although it is less common in the US, it should be treated immediately if you develop symptoms. Here are some facts about pneumocystis pneumonia. Diagnosis. For a definitive diagnosis, a sample of the patient's lung is required. Depending on the type of pneumocystis jirovecii, the doctor may collect a sample of mucus coughed up by the patient or through a process called bronchoalveolar lavage. During this process, a bronchoscope is passed through the nose or mouth to collect a small amount of lung tissue. This sample will help confirm the diagnosis of pneumocystis fungus. Blood tests may also be needed to confirm the diagnosis. How pneumocystis pneumonia spread? While many people are not aware of the exact mechanism of how pneumocystis pneumonia spreads, it has been suspected for decades that this bacterium may be responsible for the disease. Although the agent of this condition is a rodent pathogen, pneumocystis jirovecii is responsible for human infections. The organism infects the lungs by attaching to the type I alveolar epithelium, where it transforms from a trophic to a cystic form. Once attached to the alveolar epithelium, the resulting damage from the bacterium causes a widespread inflammatory response, which in turn results in the disease. The organisms are capable of causing respiratory failure and hypoxia. A person with a compromised immune system is at a higher risk of contracting pneumocystis pneumonia. This infection is more common in people with weak immune systems, such as HIV-positive patients with a CD4 cell count of under 200 cells per microliter. The fungus may remain dormant for years before it can cause disease. It is best to seek medical treatment for pneumocystis pneumonia as soon as you have respiratory symptoms. Pneumocystis pneumonia diagnosis. Diagnosis of pneumocystis pneumonia is often based on several tests. A chest X-ray, a bronchoalveolar lavage, a polymerase chain reaction, PCR, and blood tests are all necessary for a proper diagnosis. Treatment can include conventional antibiotics, alternative therapies, and oxygen therapy. In some cases, the underlying cause is unclear. Patients with AIDS are most susceptible to pneumocystis pneumonia, which is caused by a species of the fungus, Pneumocystis jirovecii. Although it is common in AIDS patients, the infection is rare in non-HIV infected patients who undergo immunosuppressive medications. In addition, patients who have received solid organ transplants may be at an increased risk for infection. Typical features of pneumocystis pneumonia include ground glass opacities of the lungs, pulmonary nodules, lobar infiltrates, and pneumatococcus. A chest X-ray will show increased opacification of the lower lungs. A diagnostic urine culture may be performed. A diagnostic sputum sample may be obtained and the presence of fungus spores. Pneumocystis pneumonia treatments. The cornerstone of pneumocystis pneumonia therapy is high-dose trimethoprim sulfamethoxazole, which is administered in 2 or 4 divided doses over the course of a week. In patients with AIDS, the course is typically 7 to 14 days, while patients with other chronic illnesses should be treated for at least 21 days. Anti-infection drugs are also prescribed for people with HIV infection, although the drug can cause rash or fever. To diagnose the infection, air samples were collected from a patient's room 2 days before the air sampling. The air samples were collected as soon as possible after microscopic diagnosis, but sometimes the infection may not have been detected in the lungs at all. The Coriolisou air sampler was used to collect the sample. This device consists of a sterile conical tube containing 15 milliliters of phosphate buffered saline and 0.002% tween 80. As the cause of pneumocystis pneumonia is unknown, it is important to treat the infection quickly and appropriately. Symptomatic treatment is essential to improve the quality of life of the patient. The goal of pneumocystis pneumonia treatment is to reduce the risk of serious complications. The fungus can cause life-threatening complications in people with AIDS and in patients who are immunocompromised. Often, the disease is treated with specific antimicrobial drugs, such as penicillin. Risk and prevention for pneumocystis pneumonia. The risk for pneumocystis is increased for HIV-infected patients with a decreasing CD4 lymphocyte count. Other risk factors include hematologic malignancies or non-P. Carinine pneumonia, autoimmune diseases, and chronic liver disease. There is no known cure for pneumocystis pneumonia, but there are several treatments. The organism responsible for pneumocystis infection is a species of fungus known as Pneumocystis jirovecii. The organism is asymptomatic in healthy individuals and occurs in only a few species of immune-compromised people. It is common in infants and the elderly and is associated with HIV disease before the immune system can regenerate. Prior to the AIDS epidemic, this infection was considered uncommon in the U.S. The disease tended to affect immunosuppressed patients with chronic illnesses and protein malnutrition. Patients on corticosteroid therapy or with a weakened immune system were most likely to develop the condition. The risk of developing PCP is increased for immunosuppressive agents and patients with HIV infection. Thank you for watching. Please like, comment, and subscribe if this was helpful.